on prevention of mother-to-child transmission of HIV. Always something that anybody can relate to. I hope that you will be able to pick up some pearls of wisdom and manage our women living with HIV better after this. So the objectives of this study, of this lecture, is to discuss the principles of HIV transmission and management, and to emphasize HIV screening, counseling, and testing during pregnancy, and to identify whatever resources we have in the management of HIV and AIDS in pregnancy. Currently, the status of the Philippines now, we have high IV drug use, and this is one of the most common causes of transmission of HIV, particularly in Cebu and Central Visayas. And we also have increased gender-based violence. However, people are becoming more aware of this. Trends show that there is an increase in the incidence of teenage pregnancy and single mothers. About 90% of the deliveries we have in our hospital are not married. And you have new cases of HIV and AIDS-related deaths. So this is the magic number, 66,303 number of reported cases since 1984, diagnosed HIV cases. And in one day, we have 36 cases diagnosed. Okay, so according to the April 2019 statistics, this is our statistics. So when we look at the statistics, we have to understand who are our clients or target population. So you can see 93% are male. And of those who were diagnosed pregnant, there was 77.5% of the women who were diagnosed with HIV were diagnosed during pregnancy. So this is, again, one of the reasons so that we should test all pregnant women for HIV routinely, as part of routine prenatal tests. So you also see, as far as age groups is concerned, 79% are within the reproductive age of 15 to 34 years old. And when you're looking at the HARP registry, 51% get it from MSM, and most data on PWIDs come from Cebu. Why is this important in PMTCT? Why? Because these males who have sex with males and these males who inject drugs are also having sex with females. And because they have sex with females, of course, they can transmit it to their children. So you can also see that there's condom use can be the intervention for males who have sex with males, and needle exchange or the operational research for people who inject drugs. And when you have to convince somebody to use condom, and when you have to convince somebody to not inject drugs, I think the interventions for preventing mother-to-child transmission is far easier than these previous two. So this is one area of intervention that we can really improve and prevent transmission of HIV. Now, when you're looking at the statistics again among children and adolescents less than 19 years old, you can see that even adolescents less than 19 years old are already sexually active. They are getting pregnant, they're getting infected with HIV, and these are males having sex with males, males having sex with both males and females. And when they get pregnant, they are able to transmit it to their child. So when you look at the number of OFWs diagnosed with HIV, there is still an exponential increase. And it's not just among the males, it is also among the females. So you have an exponential increase in the number of diagnosed cases. And when you look at the proportion of HIV by age group, you see that since 2000, 2001, 2002, there was an increase, drastic increase in those diagnosed with HIV among the 15 to 24-year-old age group. Those who are teenage pregnancy, meaning our youth are sexually active, and this is the youth that should be the target of our awareness, advocacy campaigns, okay? And among those who have transactional sex, many of them are sex workers, but clients also. So looking at the number of HIV positive women who were pregnant at the time of diagnosis, you can see that the yellow-green bar component of the bar are less than 15 years old and 15 to 24 years old. That means there is a prevalence of teenage pregnancy that is increasing and affecting HIV transmission as well. Okay? In fact, in Vicente Soto Memorial Medical Center, about 17% of all deliveries are below 19 years old. Okay? And since 2010 up to the present time, we have already enrolled more than 200 pregnant women who are diagnosed with HIV. And alive on ART are only 67 and confirmed dead are 11. So the question that we have to ask, where are the rest? No, we need help looking for the rest who are lost to follow up. As far as diagnosing patients with HIV, in the OPD, we see about 50 patients, an average of 50 patients per day who come in for prenatal checkup. But only 40% on a good day, no, are allow themselves to get tested for HIV. So from 2015 to 2018, these are the only statistics that we got. Women who allow themselves to get tested for HIV. And of 229, there was only one. In a study done in January by one of our residents, you had to test 400 pregnant women to be able to diagnose one patient with HIV. And as an evaluation of the PMTCT program, we have more than 200 patients enrolled to the program, and we had one baby who was diagnosed with HIV at birth. However, we also have about 12 babies diagnosed with HIV, but they were diagnosed after delivery already. And we have currently 23 kids upon diagnosis of HIV. So really, you have to address that pregnant women, they might not know their risk factors for HIV. So it's very important that you advise them to get tested for HIV during pregnancy, not only for their own health, but also to prevent transmission to their babies. And as far as primary prevention is concerned, we have to start in adolescence because adolescents start to have sex and start to inject drugs between 14 and 19 years old. I think in Talisay, the youngest rehab patient was 10 years old. And if you can see among cities of MSM with concentrated population, Cebu is 7.7%. So we really have to identify the patients, the clients that we want to target. As far as the DOH PMTCT program is concerned, this is the document, the administrative order that we follow. And according to this document, there are 4 prongs to prevent mother-to-child transmission of HIV. The first is to prevent a reproductive age woman from getting HIV. The second is if you cannot prevent them from getting HIV, you prevent them from having unintended pregnancy. So offer family planning. So they already have HIV, you don't want them to have unintended pregnancies. But if you cannot prevent that, those who are already HIV positive and already pregnant, then at the very least, you can prevent transmission of HIV to their unborn child. The 4th prong is after delivery, you have to provide treatment, care, and support to these women living with HIV, their children, and their families, so that they will not be lost to follow up. They will be linked to care, kept alive on ART, and become undetectable and untransmissible. So the first prong is primary prevention of HIV among women of childbearing age. So this is the ABCDE. So A, abstinence. You have to wait for your one true love. B, you have to be faithful. You have to be mutually faithful. And C, ideally, when you're talking to the youth, you don't mention condoms yet. You ask them to check their status. Especially if they have risk factors, get tested. And then if they are HIV positive, you advise correct and consistent condom use for every sexual encounter. Okay, and D is don't do drugs, don't inject drugs, or don't drink alcohol, because when they get inebriated, they lose control of their senses, they lose control of whatever they have, and they end up doing crazy things that may put them at risk for HIV transmission. There was a patient actually who mentioned when I asked her, how many sexual partners do you have? And she said, I don't know, I can't tell you. Why? Because I came into a party on a Wednesday and I went out on a Saturday and I didn't have my clothes. They were strewn out the floor of the hotel room. So really, don't do alcohol, don't drink alcohol, and don't inject drugs. And you have to educate yourself and others. Okay, so this is one of the examples of how we do it in the communities, talking about HIV to adolescents. It's good that they actually are aware and they are now slowly, no, the movement is spreading across barangays and in schools also, that they are aware of what HIV is and how it can be prevented. So the second is they are already HIV positive. You want them to plan their pregnancies, no unintended pregnancy. So you have to offer them family planning. And the best protection to prevent transmission of HIV really is correct and consistent condom use. But on top of condom use to prevent transmission of HIV, you want them to use long-term contraceptive methods to prevent pregnancy. Okay? So this is the concept of dual protection. You have a long-term contraceptive method to prevent pregnancy, but at the same time, you also have protection from transmission of HIV using the condom. So even if you have an IUD inserted, you still give out condoms so that the serodiscordant partner, no, the couple that's serodiscordant will not transmit HIV between themselves. The third is you have an HIV positive pregnant patient already. You want to prevent transmission to the unborn child. So there are a lot of interventions during pregnancy, during labor and delivery, and postpartum. So it all begins with HIV screening, counseling, and testing because you have to diagnose to be able, it's a gateway to treatment care support and prevention. During pregnancy, you can administer antiretroviral drugs as early as 14 weeks so that the viral load will be reduced to undetectable. And when you deliver the patient, you deliver by cesarean delivery at 38 weeks. And as far as infant feeding is concerned, very controversial, but the patient has to make a decision because she will be the one to take care of the child, whether or not the baby has HIV. So they have to choose between exclusive breastfeeding or exclusive AFAS replacement feeding. And also, of course, on the postpartum period, you have to offer family planning so that they will be able to prevent subsequent unintended or unplanned pregnancies. So providers of obstetric care should inform the patient that an HIV screening test will be performed as part of recommended routine antenatal package of tests. So everybody, all pregnant women will have CBC, urinalysis, right? HBsAg, RPR for syphilis, and then include always your HIV. Just tell them this is as routine as CBC because if you are found to be HIV positive, then we can do intervention to prevent your child from acquiring the infection. Only 5% of those HIV positive pregnant women have received antiviral medications to prevent mother-to-child transmission. And among those who have risk factors, no, very few of them actually get themselves tested. This is the key message that you have to give the pregnant woman. The fact that you are pregnant is an evidence of unprotected penetrative sexual contact, which is also a mode of transmission of HIV. So you remove all biases of promiscuity, you remove all judgment that the client has risk factors for HIV. You're pregnant, so that means you had sex, and sex is one of the modes of transmission of HIV. So it would be better to be tested so that you know if you're HIV positive or not, so that we can give you interventions to prevent transmission to your child. So this becomes part of routine assessment of health status during pregnancy. You also include, you offer the services possible to HIV positive patients, and you have to ensure strictly, the results will be strictly confidential. It will be between me and you and the team who will be managing you. Now, if the patient still does not want to be tested, then we have to respect their autonomy. So they can opt out and still receive the same standard of care. However, during the next meeting or the next consult, please still advise, offer the test if they would take it. And now we have option B+. You start triple ARVs as soon as diagnosed and you continue for life. It's test and treat. You can give ARVs as early as 14 weeks in pregnancy, but the DOH reminds us to make sure that there is at least 4 weeks of antiretroviral drugs before delivery to reduce viral load so that the risk of transmission to the baby will be lessened. So the PMTCT program is to simplify the requirements. Once they are tested positive or reactive, then you start ARVs. Even without a confirmatory, I still would give the ARVs because I want to get that child, prevent HIV transmission to the child. Okay? So once ARV is started, it is taken for life. Oh, my forever sa HIV, it's ARV. So easy to remember. Once started, taken for life. So as far as delivery is concerned, we schedule elective cesarean delivery at 38 weeks age of gestation. Okay? Ideally, this will be elective cesarean section. We don't want pregnant patients to go into labor. Vaginal delivery may be allowed if the viral load is less than 1,000 copies and the mother is already taking antiretroviral drugs. Okay? When we're talking about essential intrapartum newborn care, so there are core steps to EINC. So we still thoroughly dry the newborn infant. We allow skin-to-skin bonding. We do not delay cord clamping anymore. And latching is only done if the patient has decided to exclusively breastfeed. Okay. So when we're talking about infant feeding, there has to be a patient choice. There has to be informed consent because it is actually the mother who will take care of an HIV-exposed baby. So even before they deliver, they have to make this counseling already. The patient has to choose between exclusive breastfeeding or exclusive AFAS replacement feeding. AFAS replacement feeding is affordable, acceptable, feasible, affordable, sustainable, and safe. These may be formula milk feeding. It may be expressed breast milk which is heated, or donated breast milk, some milk coming from milk banks. Okay, there are a lot of options for the HIV exposed infant. However, last July, our society got together to make a position statement, and this was further presented during a joint meeting of PIDSP, PISMID, and PIDSOG with in the presence of the DOH. So our stand really is that cesarean section will be the standard of care, and breastfeeding, direct breastfeeding, is not recommended for women living with HIV because the risk of transmission is not zero. And in our country, there are other possible options for infant feeding. Okay. So you prevent HIV infection among healthcare workers. Standard precaution is enough. If you have needle stick injuries, you have to get post-exposure prophylaxis and make sure of hospital infection control. So fourth prong will include treatment, care, and support to women living with HIV and their families. And the WHO has a framework of all of the recommendations for women living with HIV. It has to be women-centered. It has to promote gender equality and preservation of human rights. This will include your violence against women services, the family planning, you have your antenatal care for those who are already pregnant, you have safe abortion services, and you have sexually transmitted infection services because there are links between STI and HIV, and also sexual health, reproductive rights. Okay, so adolescent-friendly services will be included in healthy sexuality across the life course. You also have to make sure of the supply of your antiretroviral therapy and protection from violence, especially when the woman is ready to disclose to her partner. Okay, and you want community empowerment, HIV 101 in the community so that everybody is informed what HIV is and how it can be prevented, and stigma reduction, first of all, among healthcare professionals, because the stigma and the discrimination usually starts with us. Okay, so these are the health interventions that you can give a woman living with HIV. So violence against women services when she discloses. Children of school age, when they enter puberty, there is this problem with disclosure. How do you inform the children who get HIV perinatally of their status? And then correct and consistent condom use. And PLHIVs can use hormonal contraceptives. They can also use the levonorgestrel releasing IUD or even a copper IUD as long as there is no pelvic infection. Okay? So I usually end with this picture. This guy is HIV positive, and he got the HIV from his parents who are both HIV positive. He met the love of his life, his beautiful wife, who is HIV negative, because he has been taking antiretroviral drugs for all of his life. He is undetectable and untransmissible. So they have three beautiful children who are all HIV negative. So this is the vision. No? If you need a picture of what we aim in the prevention of mother-to-child transmission of HIV, this is the picture that we want to keep in our minds. That you may have one person who is HIV positive, that the rest of the family is negative. Okay? So thank you very much.